I'm Dr. Daniel Dodson. I'm over here at North Oaks Eye Care Clinic in Hammond, Louisiana. Exposure to the sun comes UV rays, and with UV rays can come an increase in the size or growth of cataracts. That's probably the most common thing I see in my clinic related to sun. Other things that are more common are with macular degeneration, quite common in Caucasians above the age of 60. Sun exposure or UV exposure can worsen macular degeneration and bring it on at an earlier onset. And then lastly, something that people forget about is the skin around the eyes. Very susceptible to the UV exposure, which can lead to precancerous and cancerous growths. There's many different ways to help protect your eyes from sun exposure and UV exposure. And one of the simplest ones that everybody knows about is wearing sunglasses. The key with sunglasses, what you want to look for in a good pair, would be anything that has a UV protection sticker on it, and that's key because technically in the US we're not supposed to be able to sell sunglasses that don't have UV protection. Other simple solutions would be, if you know you're going to be outside gardening or doing yard work, wearing a wide brim hat that covers 360 degrees around is a great tool at minimizing the amount of light exposure to the eye, and that also helps the skin and the other areas around the face as well. Other things people forget about are on overcast days. You think it's cloudy, you know, the sun's not bothering your eyes too much, but there's still plenty of UV light that's coming through those clouds. Just like you can get a sunburn on overcast days at the beach, which I'm sure many of us find out the hard way. The same thing goes with your eyes. You're still getting that same amount of exposure, you just don't realize it. And so wearing the sunglasses, the wide brim hats is important on those days, as well as the sunscreen in all parts of exposed skin. Other things that are good, knowing what prime time hours of the day where the sun is actually going to be at its peak, and that's between the hours of 10 and 2. Typically are your hottest points of the day, and that's when your sun is directly above, and that's when you're getting the most exposure. So just by changing the time of day you're going to be outside can help minimize the risk of the sun exposure. And now, protection for children. One key that's needs to be noted in regards to your children is that most of your sun exposure and damage is done before the age of 18. And so all more important is to take care of those kids before that age of 18, so that you're reducing their life-term exposure to these situations. So again, it goes back to wearing the sunglasses. If you're going to go to the beach, if your kids are outside playing for extended periods of time, the prime time season during the day, especially over the summertime, that's the key. Try to convince them to wear those sunglasses, and you know, little kids think they're cool anyway. So you know, if you can convince them, show them somebody who they look up to that wears them, then they a lot of times they want to wear them. And the same thing goes with wearing the hats and wearing sunscreen. And so, as a reminder, also, people tend to, as long as your eyes aren't hurting you or you're not in pain, they tend to be overlooked. So it's really important to get a baseline exam for all children by the age of 5 or 6, because there's many eye conditions that can be easily corrected before that age, but if waited till afterwards, you're not going to be able to correct certain ones. So very important in that note. Adults, initial exam at the age of 40 unless you're having a problem, come in sooner. And then at the age of 50, everybody's recommended getting an annual exam.